Introduction. What is tachycardia? In the intricate symphony of the human body, the heart plays a vital role, steadily pumping life-sustaining blood throughout our system. Like a conductor setting the tempo, our heart rate determines the speed at which this vital fluid flows. However, when the heart's rhythm goes awry, beating too fast and exceeding the normal range, it falls into the realm of tachycardia. Tachycardia, simply put, is a condition characterized by a heart rate exceeding 100 beats per minute at rest. While a fleeting episode of rapid heartbeat during exercise or moments of excitement is considered normal, persistent tachycardia can signal an underlying medical issue. Understanding tachycardia is crucial, as it can range from a harmless temporary condition to a serious medical emergency. This comprehensive guide aims to demystify tachycardia, shedding light on its various types, symptoms, and treatment options. Whether you're a healthcare professional seeking a refresher or an individual keen on understanding this cardiac condition, this guide will equip you with the knowledge to recognize and address tachycardia effectively. Imagine the human heart as a complex electrical circuit, with impulses traveling through specialized pathways to orchestrate each beat. Tachycardia occurs when these electrical signals are disrupted, causing the heart to race unnecessarily. Factors that can contribute to this electrical disturbance include stress, caffeine, medication side effects, and underlying heart conditions. Recognizing the signs of tachycardia is crucial for timely intervention and management. A persistent and significantly elevated heart rate should never be taken lightly. When the heart races for prolonged periods, it can compromise its ability to effectively pump blood, leading to a cascade of health complications. The consequences can range from mild discomfort to life-threatening situations, depending on the severity and underlying cause of the tachycardia. One significant risk associated with untreated tachycardia is heart failure. A heart forced to constantly work overtime, beating at an accelerated rate, can weaken over time, losing its ability to efficiently pump blood. This can lead to fluid buildup in the lungs and other parts of the body, resulting in shortness of breath, fatigue, and swelling. Moreover, tachycardia can increase the risk of blood clots forming in the heart. When the heart chambers don't have enough time to fill properly between rapid beats, blood can pool, creating an environment conducive to clot formation. If a clot dislodges and travels to the brain, it can obstruct blood flow, leading to a stroke. Tachycardia is not a one-size-fits-all condition. It encompasses various forms, each with its own set of characteristics, causes, and treatment approaches. Understanding the different types of tachycardia is crucial for healthcare professionals to make accurate diagnoses and tailor treatment plans effectively. Broadly, tachycardia can be classified into two main categories: supraventricular tachycardia and ventricular tachycardia. Supraventricular tachycardia, as the name suggests, originates in the upper chambers of the heart, the atria. This type of tachycardia is generally less serious than ventricular tachycardia, and often arises from problems with the electrical conduction system in the atria. SVT typically presents with a rapid, regular heart rhythm and can be triggered by stress, caffeine, or certain medications. In contrast, ventricular tachycardia originates in the ventricles, the lower chambers of the heart responsible for pumping blood to the body. Ventricular tachycardia is considered more serious because it disrupts the heart's ability to pump blood effectively, potentially leading to life-threatening complications like cardiac arrest. VT often arises due to underlying heart conditions such as coronary artery disease, heart attack, or heart muscle damage. The symptoms of ventricular tachycardia can vary depending on the severity, ranging from palpitations and dizziness to loss of consciousness. Sinus tachycardia, a common type of tachycardia, stems from the sinus node, the heart's natural pacemaker located in the right atrium. The sinus node generates electrical impulses that regulate the heart's rhythm. In sinus tachycardia, the sinus node fires these impulses at a faster rate than usual, leading to an increased heart rate. While sinus tachycardia can be a cause for concern if it persists, it is often a normal physiological response to various stimuli. Physical exertion, emotional stress, fever, dehydration, and pain can all trigger sinus tachycardia as the body tries to meet the increased demand for oxygen and blood flow. In these situations, sinus tachycardia is considered appropriate and usually resolves on its own once the triggering factor is addressed. For instance, after a strenuous workout, the heart rate gradually returns to its resting state as the body recovers. However, if sinus tachycardia persists even at rest or occurs without any apparent trigger, it could indicate an underlying medical condition. Hyperthyroidism, anemia, heart failure, and certain medications can all contribute to persistent sinus tachycardia. Therefore, it's essential to consult a healthcare professional to determine the underlying cause and receive appropriate treatment if necessary. Section 5. Supraventricular tachycardia above the ventricles. Supraventricular tachycardia, or SVT as the name implies, originates above the ventricles, specifically in the atria or the atrioventricular, also known as the AV node, which serves as an electrical relay station between the atria and ventricles. SVT is characterized by a rapid and often regular heart rhythm that starts and stops abruptly. It is a relatively common type of tachycardia, affecting millions of people worldwide. Several factors can contribute to the development of SVT, including congenital heart defects, certain medications, caffeine, alcohol, and illicit drug use. In some cases, the exact cause of SVT remains unknown. Symptoms of SVT can vary from person to person, with some individuals experiencing no noticeable symptoms, while others may have palpitations, shortness of breath, dizziness, lightheadedness, chest pain, or even fainting. Treatment for SVT aims to restore a normal heart rhythm and prevent future episodes. Lifestyle modifications such as reducing stress, limiting caffeine and alcohol intake, and avoiding triggering substances can be helpful in managing SVT. In some cases, medications may be prescribed to control heart rate and rhythm. For more severe or recurrent cases, procedures like catheter ablation, which uses heat or cold energy to destroy abnormal electrical pathways in the heart, may be recommended. Section 6. Ventricular tachycardia, a cause for concern. Ventricular tachycardia, or VT, is a serious type of tachycardia that originates in the ventricles, the lower chambers of the heart responsible for pumping blood to the body. Unlike SVT, which typically arises from problems with the electrical conduction system, Vermont often stems from damage or abnormalities within the heart muscle itself. This makes VT potentially life-threatening, as it can disrupt the heart's ability to pump blood effectively, leading to a cascade of complications. Several factors can increase the risk of developing VT, including coronary artery disease, heart attack, heart failure, cardiomyopathy, and certain genetic conditions. When VT occurs, the ventricles beat too fast, preventing them from filling with enough blood between contractions. As a result, the heart cannot pump enough blood to the body, leading to a drop in blood pressure and potentially life-threatening complications like cardiac arrest. Symptoms of VT can range from mild to severe and may include palpitations, dizziness, lightheadedness, shortness of breath, chest pain, fainting, and even cardiac arrest. Prompt medical attention is crucial if you or someone you know experiences these symptoms, as VT is a medical emergency that requires immediate treatment. Section 7. Recognizing the symptoms. When to seek help. Recognizing the symptoms of tachycardia is crucial for timely intervention and management. While some individuals may experience tachycardia without any noticeable symptoms, others may present with a range of symptoms from mild discomfort to severe distress. The severity and type of symptoms can vary depending on the underlying cause of the tachycardia, the heart rate, and the overall health of the individual. Common symptoms of tachycardia include palpitations, shortness of breath, dizziness, lightheadedness, chest pain, and fainting. In some cases, individuals may also experience fatigue, weakness, anxiety, or a sense of impending doom. If you experience any of these symptoms, it is essential to seek medical attention promptly to determine the underlying cause and receive appropriate treatment. It's important to note that not all tachycardia requires emergency medical care. For instance, if your heart races during exercise or in response to stress, it's usually nothing to worry about. However, if your heart rate remains elevated even at rest, or if you experience any of the aforementioned symptoms, it's crucial to consult a healthcare professional. Section 8. Treatment options. Restoring a normal rhythm. Treating tachycardia effectively involves addressing the underlying cause and restoring a normal heart rhythm. The specific treatment approach may vary depending on the type of tachycardia, its severity, and the individual's overall health. In some cases, lifestyle modifications alone may suffice, while others may require medications or medical procedures. For sinus tachycardia, which is often a physiological response to stress or exertion, simply removing the trigger may be enough to restore a normal heart rate. Staying hydrated, managing stress levels, and avoiding caffeine or other stimulants can also be helpful. If an underlying medical condition like hyperthyroidism or anemia is contributing to sinus tachycardia, treating the underlying condition usually resolves the tachycardia as well. For more serious types of tachycardia like SVT or VT, medications may be prescribed to regulate heart rate and rhythm. These medications work by slowing down the electrical signals in the heart, preventing it from beating too fast. In some cases, a procedure called catheter ablation may be recommended. Section 9. Conclusion. The importance of timely action. In the symphony of human physiology, the heart plays a lead role, its steady rhythm a testament to the intricate dance of life. Tachycardia, a condition characterized by a heart rate exceeding the normal range, disrupts this harmonious rhythm, potentially leading to a range of health complications. Understanding tachycardia, its various types, symptoms, and treatment options, is paramount for both healthcare professionals and individuals alike. Recognizing the symptoms of tachycardia, from palpitations and shortness of breath to dizziness and chest pain, is crucial for seeking timely medical attention. Early diagnosis and treatment are essential for preventing serious complications such as heart failure, stroke, and cardiac arrest. While lifestyle modifications like stress management and avoiding triggers can be helpful in managing certain types of tachycardia, others may require medications or medical procedures to restore a normal heart rhythm. As we conclude this exploration of tachycardia, it's vital to remember that knowledge is power. By understanding this cardiac condition, we empower ourselves to take charge of our heart health and seek appropriate medical care when needed. Through early detection, effective treatment, and proactive lifestyle choices, we can orchestrate a healthier future for our hearts, ensuring they continue to beat in sync with the rhythm of a long and fulfilling life. Certify today at affordableacls.com.